No peel, no laser, no injections, and younger looking skin in just 1/2 hour. Peggy Pico with a new face fix. Coming up later. Now, NBC 739 News at 11.
A new procedure promises to zap away wrinkles and sun damage.
Using no peel, no knife, no injections. Our medical correspondent Peggy Pico with a closer look at the new face fix.
The FDA procedure can only be done by cosmetic doctors. They use what looks and acts like a laser but isn't to erase sunspots and premature wrinkles. And it's so hot it's already got the attention of one young woman from Lakeside. Energy like this. And the sizzling heat of the sun harnessed in this handheld device. Designed to zap away wrinkles with pressurized gas instead of laser light therapy. 25-year-old Sarah Celeste hopes this new face fix will erase the skin damage from too much tanning in her teens.
I have a lot of sun damage, and I think that this is the first step to improve.
Numbing gel applied hours earlier is the first step of this surgical facial done while you're awake.
Here we go.
Several shots numb Sarah's face further. Drops are needed so Sarah won't feel the thick, protective plastic covers inserted into her eyes.
No, I don't see anything.
Unlike lasers, which use light, this portrait machine shoots condensed gas into deep layers of the skin to stimulate collagen growth.
So there's no damage to the top layer of skin initially, but over a period of a few days, that top layer will shed.
There's no contact between machine and skin.
Right above the skin, about 5 millimeters above. You can see there's no charring at all.
Sarah's having a full facial done. It'll take about 30 minutes, but if she was just having her eyes done, she could be finished in about 10.
I don't feel anything.
Until she got home.
The first 2 days I took Vicodin to make myself a little more comfortable. But pretty much after that, I was fine.
Her before photo on the left, and on the right, 10 days after treatment, she has some redness and swelling. But by that time, the sheets of peeling skin had already fallen off.
By day 12, I was wearing makeup, doing my normal routines.
3 weeks later, without makeup, she looks like this, but only with the help of Botox injected by her doctor afterwards to enhance results.
We tailor each treatment to every patient's needs.
Treatment 39-year-old Rachel Finley did 6 months ago to get rid of wrinkles.
I had crepiness and wrinkling all the way down into my cheek beds.
She has some fine lines and texture changes of her skin in the pre-photo. If you look underneath the eyes in the after photo, you can see that those lines are virtually eliminated.
Dr. Groff says portrait facials work best on light to medium skin tones.
So how about African American, Hispanic, Asian?
They certainly can be treated. We just need to be a little bit more cautious with those skin types because they're more prone to developing side effects.
Sarah says she didn't have any side effects and promises to take better care of her newly energized skin.
As long as I take care of my skin, hopefully it'll last years, but we will see.
The portrait facial is a cosmetic procedure, so it's not covered by insurance and it's not cheap. A full facial like Sarah had cost around $4,000, but the results are said to last for years. Marty, Susan?
Thank you, Peggy.